have a lot of patients who come in who are wondering why they really need to have weight loss surgery. They may be overweight, they may be obese, but they say, "Doctor, I'm really healthy. I feel great." And essentially they are somewhat healthy, but they don't realize the changes that are going on inside of their bodies. The changes that have occurred with increased weight. I call it the Mount Everest effect. As you know, anyone who tries to climb Mount Everest, when they start, they have to start at base camp, which is about 18,000 feet, and they have to acclimate. They go up then to 21,000 feet and acclimate, and they go up to 27,000 feet and acclimate. If they were to go right to the top of Mount Everest without acclimating, they would die. Their body couldn't handle it. It's the same thing with weight loss. As we gain weight, our body starts to acclimate. It tries to maintain what we call homeostasis. In other words, as we increase our weight, the pressure inside of our abdominal cavity increases, and in some patients that causes them to have urinary incontinence. It puts pressure on our diaphragm, which pushes up on our lungs, and our body then has to breathe more times per minute. It increases the amount of our vasculature, and so our heart has to pump harder, and so over time our body compensates to try to keep up with this change that's occurring as we gain weight. At some point, a person will reach the end of their ability to compensate. And that's when things start to break down. And so a patient that's overweight is in that period, that time of compensation. They're trying to compensate for all these changes occurring in their body as the body continues to try to maintain, like I said, what I call homeostasis, or a normal state of functioning while they're gaining weight. And so a person who is overweight is really not in as good a health as they think they are, because their body has compensated for all these changes that have occurred over time. That's why it's very important that when you have weight loss surgery that you go to someone who understands these concepts and principles, because the surgery puts a big stress on a person's body. And a surgeon who has a lot of experience and knows what to look for can compensate for any possible problems that may occur as the surgery goes on.